All right, welcome back, everybody. For those just joining, I'm Kelly Davis. I use she, her pronouns, and I am the Director of Peer Advocacy Supports and Services at MHA. And I really focus all of my work on the power of lived experience as a means to transform mental health and mental health services. And one of the most awesome things I get to do, among all the great things I get to do at MHA, is working with our Collegiate Mental Health Innovation Council. So CMIC was launched in 2017. And it was developed to highlight student-led programs that fill gaps in traditional mental health services and supports on campus. There's been a lot of attention paid to the growing campus mental health crisis. Young people are really having a hard time. And, in my experience as a college mental health advocate, I found that, people were willing to listen to me talk about my distress maybe, but they weren't willing to listen to me talk about the things that I thought should be done to change it. And that's an experience that many young people have across the country, where they feel like I have awesome ideas about how to impact my community. I don't really know how to get started, and I don't know where to go. And CMIC was really designed to find students who were doing that work, who created cool things, and to highlight their voices, but also their programs. So CMIC meets every year. There's members who are selected from across the country. We have monthly meetings to discuss the major challenges and solutions that they see in mental health, to share their knowledge and experience to the broader MHA network, and also to develop an annual report highlighting trends and their perspectives as students. So what do they see as the major issues and challenges for them and their peers, but also to highlight their work. So the report is a highlight about the young people and college students' lived experience on campus, but it's also a guide on how they got started with their program, what are some issues you might run in doing something similar, and how can you get in contact with this person directly to help build something similar on your experience. Because so often many students who are doing advocacy are kind of dismissed or pushed aside, or their universities say that's a liability, we can't do that, we know what's best for you. And students can say, actually, no, this is a great idea, and here are students who already did it, and I'm actually in discussion with them, and here's how we can do it here. So today I am pleased to have several of our phenomenal CMIC members with us to talk about their programs, their backgrounds, and how they've worked to find new ways to fill gaps in traditional mental health services and supports on their campus. So with us today, we have Juan Acosta, Ananya Cleetus, Marissa Howdershelt, Joi Rhodes, and Braden Renke. We're missing Shivani Nishar, who is an amazing advocate, but is a recent graduate and is at work, so could not join us today. So I wanted to kick it off by letting everybody share a little bit about themselves, their story, and their work. And then we're just going to have a conversation about, we've heard about disability justice, about the voices of lived experience, but what does it look like to move beyond listening to people's stories to taking action on their ideas, and not just integrating them, but promoting them, highlighting them, and supporting them with money and power. So I'll get started in our intros. I'll kick it off to Juan to share a little bit about the advocacy he's been doing for a long time.
Thank you so much. I'm Juan Acosta. I'm 23 years old. I was born in Jalisco, Mexico, and I grew up in Woodland, California. I attended San Francisco State University, in which I served as Assistant Director of the Queer Alliance Club. For me, it was really important to focus on creating a true and real safe space, as I like to say. Oftentimes college students are trying to obtain resources but don't know where to go. And in many classrooms, they find posters that say this is a safe space, but there's no accountability to ensuring that that space is actually safe for the student. Prior to starting San Francisco State, I was at a community college in my hometown. Growing up, for me, it was difficult, and I started my mental health advocacy because of my own struggles. My own struggles were a catalyst for me to get involved in this work, and it was important for me to change a lot of things that I felt like I needed when I was growing up. So I drafted a historic LGBTQ+ proclamation for my hometown that passed for the very first time in the town's history, and the town is much more older than I am. So it was great for me to be a part of that moment because I needed that when I grew up. And it's a lot of bravery to speak up and share your own lived experience oftentimes. And that's why I'm so proud to be here with all my fellow committee members because they all do amazing work as well. I also serve in a committee for California's Mental Health Services Oversight and Accountability Commission, in which we hosted the first of its kind regional innovation idea labs throughout the state of California with other amazing committee members as well.
Awesome, thanks Juan, and I'll kick it over to Ananya.
Hey, I'm Ananya. I'm 23 and I'm a senior in computer science at the University of Illinois, Urbana-Champaign. I was actually born in New Delhi, but I've spent most of my life growing up in Pittsburgh, Pennsylvania. And the reason I kind of got involved in mental health advocacy was through my own lived experiences as well. Growing up, mental health was something that was very, very stigmatized in the Indian American community, as it is in a lot of other communities. And I never really felt that I could talk about it or get support while I was growing up. And once I went to college, things started to get a little bit worse for me, and I ended up having to leave university for almost 2 years to take a break to focus on my mental health. And that was sort of where I think my passion for mental health advocacy really kicked off. And I was invited back to give a TED Talk at my university and share my story with other students. And I realized that a lot of other people had similar experiences, not only with dealing with stigma within their different cultural communities, but also dealing with issues with faculty training, lack of faculty compassion, and a lot of issues around mental health crisis response. That was something that I had lived through a lot as well. And it's something that I think continues to be an issue on university campuses. So that inspired me to create an app, Anemone, which is basically a mental health crisis app for everybody to basically create a crisis plan and then also have access to resources in their community, national resources, coping skills, and a virtual grounding box. So the idea behind that is just that no matter where you are, whether you're a student or anyone, you'll have access to those crisis tools. And that was something that I think was really lacking on my college campus. In addition to that, I've also been involved in a lot of mental health advocacy, specifically in the engineering and STEM space, because I think that's a really difficult climate because a lot of prestige is often related to rigor and how much students struggle. So that's something that I've been involved in terms of different projects, like getting a syllabus statement, getting mental health resources published online for students, faculty training, mental health awareness events, that kind of thing. And it's been a long journey, but I'm really excited that I've been able to be back and really happy to be a part of this committee with everyone.
Thanks, Ananya. We're all great that you're here. We're grateful that you're here. And I will turn it over next to Marissa.
Thank you, Kelly and Ananya. So my name is Marissa. I'm a queer, non-binary, first-generation college student. My preferred gender pronouns are they, them. I am a fourth-year public policy major education minor at the University of California, Riverside, and I live with bipolar 2 disorder. I grew up in the Inland Empire of Southern California, born and raised. I wanted to stay here within college because I felt that there was a need for folks to invest in the Inland Empire community, both with mental health services and just broader social services in general. So prior to the council in the 2018-2019 school year, I was involved with Lobby Corps, which is a program in our external office in the student government. And in that organization, we lobbied local, state, and federal officials on student-centered bills. Some of the work that I did specifically was on advocating for more funding for mental health services on campus. In the University of California system, we do have a quite large student population, and most of our psychological services are overpopulated and underfunded. So that is something that I wanted to make sure that stakeholders knew that this is an issue and we need to address it and we both need to fund it. So when joining the council, I was truly empowered by everyone else here and the great work that they are doing. And it really encouraged me to, look into what more can I do on my campus. Through this council, I was able to analyze leave of absence policies because, as Ananya had stated, it was something that I also had to go through. When you're a college student and you're facing mental health issues, it's really hard to keep up with your workload. And for me, it was something that I needed to do to save myself and my mental health. So I feel like um, student-centered leave of absence policies can definitely be life-saving. It was life-saving for me, and I wanted to look more into that and see how it was on the UC system-wide. So yeah, I really enjoyed this time in the council, and it really helped me recognize the injustice and ableism that we see within higher education institutions.
Awesome. Thanks, Marissa. Totally agree. And we'll talk a little bit more about what it means to be student-centered later, but I'm going to turn it over to Joi to share a little bit about you and your work with Fight Club.
Hi everyone, my name is Joi Rhodes. I am 22 years old. I was born in Memphis, Tennessee, but I have lived in Tulsa, Oklahoma for the past 4 years. I recently graduated from Oral Roberts University here in Tulsa with my bachelor's in social work. I really got into advocacy because as a freshman coming into college, I have lived experience with chronic depression, borderline personality disorder, and anorexia. And so when I first got on campus, I really had no idea how to surround myself with the services that I needed to succeed. And I really just thought maybe I just need to keep seeing my therapist and I'll be fine. But little did I know I needed a lot more than that. And so, like a lot of my other peers have mentioned, my freshman year in the spring, I ended up having to take a leave of absence. Unfortunately for me, that was kind of a forced decision on the administration's part. And taking a leave of absence was not necessarily in my best interest at the time because I definitely did have more support at school than I did have in my home environment. And so it was unfortunate that I had to leave and not really have as much support at home. But when I returned my sophomore year, I kind of just thought like, hey, that situation was pretty unacceptable and I need to figure out how students can be protected because I know that I have more rights than what was upheld during that situation. And so I really just started to have conversations with other students on campus because I knew that I couldn't possibly be the only one who had felt that way. And I started to hear similar stories about other students who had been forced to take leaves of absences. And I just really started to talk to my peers about it and decided where to start. And so what I noticed was that with our student counseling services, we only had 2 counselors on staff. And I had been hearing from other students that they had been on wait lists for almost an entire semester, sometimes 4 to 5 months to see a therapist. And I really thought that that was completely unacceptable and that when students request services, they should be granted the services they need when they ask for them, because I know it takes a lot of strength to reach out the first time and some people might not reach out a second time if waitlisted. And so I started a petition to our university president, kind of highlighting the need and needing to meet the demand for therapy on campus. And within about a week, it got 1,000 signatures, really started a conversation and caught the attention of our president. He got a committee together and decided that he was going to build us a brand new counseling center and hire new counselors. And so I was really thrilled that I was able to help amplify the student voice and letting the administration know that we had a need and that our tuition money should go towards protecting student health. Along with that, as Kelly mentioned, I started a group called Fight Club, which was ORU's first student-led peer mental health psychoeducation support group. I go to a very small Christian university, and so they often try to control the narrative on how students view mental health. And so this was the first time students really had a place where they could talk about their struggles and support each other and get the education that they needed on mental health issues. So I'm really glad that I was able to create that space for students on my campus.
Awesome. Thanks, Joi. And last but not least, turn it over to Braden to introduce herself.
Hi, everyone. My name is Braden Renke, and I'm a junior at Franklin and Marshall College. I guess you could say I started with my advocacy work because in 2018, my father committed suicide, and that really changed my life. My dad struggled with chronic traumatic encephalopathy, which basically has similar deterioration of your brain as Alzheimer's, things like that. So once that happened in my life completely changed. I really became really passionate about mental health and how I could help other people. And I almost found that to be my outlet to this whole entire situation that I've been dealing with, because through helping others, I've been able to help myself and find the resources that I need for myself. I created the Pizza Project a little over a year ago, and that has been such an awesome experience. And I'm so excited to announce that as of literally yesterday, it is now an official, organized, recognized organization on my campus, and we will now be getting funding through our campus, which I'm so excited about. The pizza aspect kind of comes in because my dad owned a pizzeria. He opened it when he was 18 years old. He actually missed school that day to open up his pizzeria, and asked the lawyer for a note so that he would get excused. So pizza was kind of something that was always a part of my life. My dad would literally close down the pizzeria I played sports in high school. So for pasta dinners the night before dinner, before games, my whole team would go in there and we'd eat pizza with him. Or he'd donate to churches, to temples, to schools, other sports teams, bands, you name it, he donated, the hospital. So I really wanted to create an organization that could not only, continue my dad's legacy and give back to the community like he did, but also to create something that could help educate people on resources. Because after everything that happened in my life, I didn't know really necessarily where to look, who to talk to. Figuring out who I was comfortable talking with was a whole other struggle. So really creating an organization that makes mental health resources easy to find and very accessible. So the Pizza Project, we put together a website, myself and some other peers on my campus that I'm so thankful for helping me set this up. We basically have been talking to different student organizations on campus and asking, what do you think you might need as a resource, or what have you found helpful? And it's basically a website that lists all these resources, and then we've posted QR codes around campus so that people could easily access them by just scanning the QR code and then going away, because some people don't feel comfortable reading, mental health posters in front of others. This kind of, works on breaking the stigma, but also makes an environment where people are comfortable getting the resources without, being seen in front of some poster. Also, the pizza aspect of this, we hold bi-weekly free pizza giveaways, which has actually created an environment where people feel comfortable to come up and talk to me about different things that they're struggling with, how they can get involved, sharing resources. And there isn't one college kid that doesn't like free food. So that's been a really great way to bring people in. And also in the picture in the beginning, I don't know if you saw it, but that's my dog, Sandy. She comes to school with me, and Sandy also attends these free pizza giveaways. So that's another thing, free pizza and petting dogs. Great way to get people in. So yeah, that's about the Pizza Project. And lastly, I'd just like to say I'm really thankful to be a part of this group. Kelly has helped me tremendously. All of my other peers on this council, thank you so much for everything you've done.
Yeah, thank you all. It's so excited everyone's got to hear a little bit about your stories. And I think going off of something Joi said, and I kind of got at this in the beginning, there's a large movement, excitingly, to listen to the stories and experiences of young people. But often, they'll say, oh, we'll bring a young person on this panel, or we'll put a young person on our council. But we're not necessarily committed and invested to doing things differently and actually listening to and implementing their ideas. So for folks who are listening out there, we want storytelling to be important. We want people to share their experiences, but storytelling isn't the end, right? Something's supposed to come after storytelling. So what has it been like for you all to actually say, you know what, yes, I'm going to step up and tell my story, but I'm going to create something different too. What has it been like? what was it like to step up and take initiative on your campus, and what was that experience like for you? And I'll start it off with Juan again.
For me personally, well, I've encountered that, and it's something that, well, I like to call it tokenism, you know, when you're asked to share your story and be vulnerable and be at your like most brave moment, sharing like past trauma or past experiences that really hit home to you, but they're not being accountable for what comes after, right? And for me, it's always been important to be intentional in the work that I do, but also expect that from the people that I work with or for. And I feel like oftentimes there's this misconception that the youth or young people can't lead. But what I've seen is like with my peers here and outside of it is that young people are leading, especially in this moment. And we are all going through this moment collectively, but I feel like it presents us with an opportunity to be more intentional about it. People are struggling with their mental health. It's no news for anyone. We know that. So now that we know that, what are we going to do to change the system? We can no longer be providing youth with resources without asking them what they need, because then it's just an offer, but does it truly serve them if you're not asking them for their opinions and perspectives? And that's why being a part of that committee for the state's mental health commission was truly valuable to me, because for one, I was able to bring youth and other leaders together to have a collaborative conversation that really ensured that they were communicating. We can't have people speak at us anymore, nor hand things to us after they've already been completed. It's important to gather that perspective and that lived experience to make things truly work and function for all and not just some.
Thanks, Juan.
I definitely agree with that. On my end, like I had mentioned before, something that I did was, make stakeholders know that, there's a need for funding of mental health services on our campuses. I don't think it's fair for them to, admit students that are from marginalized communities and not have the resources or means to, truly let them thrive. We really have to start questioning, why is it that, students have this, broke college student trope? Like, why is it? Why are we struggling with housing and food insecurity? We really have to start questioning that, and we really have to start holding these institutions accountable, because at the end of the day, we are here to learn, but we are also paying for tuition. And yes, it does take a lot of bravery and courage for us to stand up for ourselves, but we don't have to be the only ones doing this work.
I agree completely. Oh, sorry.
Oh, it's okay.
I agree completely with that, because I think something that gets glossed over so often is the fact that you can't get the youth perspective without the youth. And exactly like what you mentioned earlier, like the idea of having a council where there's one young student on the council, I think really defeats the whole point. And so something that I think has been really, really helpful in getting that perspective out there, honestly, is strength in numbers, sort of what Joi was talking about with getting a lot of support on the oh my gosh, the survey I think that she said she put out. But basically just finding people around you who are willing to rally with you, and you're willing to elevate their voices and find a place to actually meet with not only faculty, but also administration, because I think there's typically a disconnect between both of them and the actual student needs. That's definitely something that I've seen at my university. But just getting that group of people together who, are willing to go on this, willing to talk about this, willing to share their experiences. Because everywhere you look, you'll find these experiences, whether people are posting memes online or, posting on Reddit or just telling you their stories. This is definitely something that a lot of people go through. But sometimes you need that whole group to give people the strength to come forward and give people the strength to share their story. And I think that has been really helpful in getting faculty to listen to us and getting administration to listen.
I agree with Ananya and Marissa. Like they said, I think it's important for us to stress to administrators that students are the experts on student mental health, not administrations. And really for me, especially on my campus, it's just been about, I really value authenticity. It's been about calling out hypocrisy. And if there's a university that wants to boast about how great they are, but they're ignoring student mental health, I'm going to want to call that out. If you have a president who says that we value our students' mental health, and for me, particularly at a Christian campus, who does a chapel sermon about depression and how we support people, but we're spending money on a new athletic complex and not into our student mental health services, well, I'm going to have a problem with that. And as an advocate, I'm going to say something about it. And so I think it's really all about channeling that kind of righteous indignation that I think we all share as advocates for when we see something that we have a problem with and speaking out. And that will remind other students that, hey, like I have a voice too. And I also have a problem with this, which means that I can say something about it as well.
I couldn't agree more with what all of you have said. Just kind of my whole initiative, the Pizza Project, goes from a student perspective, because that's something, basically something that all of you have stated in this, is that, you know, students are the ones that are going through this. Students are the ones that are dealing with these issues. And by polling other students and asking them what they find, you know, that have helped them or what they might need, that's really important, because, you know, at an administrative level, kind of again what you guys have said, but, you know, blank statements have been thrown out saying, you know, we care about student mental health, or here are some resources. And, you know, not all the time they're not the greatest, or those, you know, statements feel kind of empty. So I really think it's important, while it's, you know, definitely a burden on the student, I think it's really important for the student to get in there, be a little bit vulnerable, share their voice, but also, you know, by doing that, getting other students inspired to do the same thing and really help other students find their voices. And again, strength in numbers. I've seen that at my campus. You know, one person, you know, feels vulnerable, shares it, more people jump in. And that strength in numbers, I think, is really what changes things on campus.
So I guess for, it sounds like what, you know, you've all mentioned strength in numbers. For folks who are listening, and for young people in particular who are listening, what are some strategies or some things that have worked for you all around bringing people together, around activating and mobilizing other young people? I'll start off with you, Joi, because, you know, you so quickly got so many people to sign on to your initiative. How did you do that? And what would you recommend for other young people looking to do something similar?
Right. Well, I will say as a caveat, I go to a very small school of about 4,000 people. But regardless, I found that it really was just about talking to the person that I see in the library, talking to a friend, and really about, I'm such a big supporter of self-disclosure and vulnerability. And if you're talking to a student and they're struggling with something and you can relate to it, say that you relate. Say, yeah, I struggle with depression too, or there was a time in my life where I was suicidal. And it shows people that, like, hey, she's talking about this and it's okay for me to talk about it. And then everyone realizes it's okay for us to talk about this. And social media has also been a big outlet when I was passing around the petition, reaching out to close friends and just encouraging them, because I realized that what I wanted to say with my petition was what thousands of students on campus had been thinking, but had been afraid to say the whole time. And so, like a lot of my peers have said, like, as an advocate, once you step up and say it, I promise you there will be other students who are just waiting to step up and to join you and really rally around that cause for sure.
I think the
Go ahead.
I think the transparency is such a big piece of that, and I'm really glad you said that, because that's something that I've seen on my campus as well, is that I think just by virtue, mental illness makes everyone feel like they're alone, when in reality, people aren't alone at all, but it takes the first person to sort of go forward and say, like, hey, I've been through this as well. These are some of my experiences. And even though that's extremely hard and terrifying, you know, as an advocate, to start off by being so open about your story, you'll be surprised how much it empowers other people around you to also be open about their story. And so I think that definitely is the first piece, is really putting yourself out there and letting people know that it is okay for them to also speak up about what they've been through. And everyone's experience is completely valid, but you'd be surprised how many people have such similar experiences, but just didn't realize that they did have such similar experiences.
I would say in the beginning of, you know, after losing my dad and everything, I was kind of in the mindset of, I don't want anyone to know what happened. I don't want anyone to know what's going on with me. I want to kind of cover this up because I don't feel comfortable being vulnerable. But after time went on, couple months, I really noticed, these things on campus and these things in my community where I just was like, this is not acceptable. Mental health resources need to be there. Students need to know what's accessible to them, because I know I can't be the only one struggling. There has to be other people struggling as well. And, by being that advocate, stepping up and being that person to, put your story out there, while it may make you uncomfortable, the amount of people that, you might never expect to be dealing with anything, because every day they put on a brave face and, are the most confident person in your class, or the star athlete, or someone that's an amazing musician. You might think, oh, they have it all figured out. They have it all together. Everyone's dealing with something, no matter where you come from or what you look like, or, anything. So I think, being that advocate, it really, as what you guys have said, it helps people feel comfortable to talk to you, and being relatable, and putting your story out there just really like has other students come out, which has been a great step at Franklin and Marshall. So many people have been coming out now that, I put the pizza project out, and other movements on campus, again, kind of linking back to the strength in numbers, really just getting out there and being, brave and putting yourself on the line, essentially, really has helped other people tremendously.
I agree with everything that y'all have said. Definitely, it's something as simple as organizing like-minded folks. It's okay to start small. A lot of times when people think about starting something, they end up, discrediting the power of their voice and their own lived experiences and their narrative. Just like y'all have said, it's about really empowering yourself and empowering others to, speak up about their lived experiences and what they have gone through. And something that Joi had mentioned, definitely like don't underestimate social media. It's definitely a source that we all use, we're all engaged with. It's an outlet where we can both educate others and, discuss stuff that is going on in our personal lives. You can definitely use it to transform into a healing place. I know that it can definitely go both sides of social media, as it can be toxic, but you have the ability to transform it into a healing space. And one last point is, learn how to work in a team and depend on trust on others. I promise you that you are not the only one going through something. There is always someone else going through the exact same thing or something very similar. It definitely does take a lot of bravery to speak out, and y'all should definitely recognize that, but just know that you are never alone.
Thanks, Marissa.
I'd like to echo everything everyone else said. It all kind of circles back to stigma and leadership. The stigma of speaking up and of these conversations, many different cultures or other spaces, but that's where the leadership aspect comes in. If one person is able to speak up, and this is the mindset that I take in when I do a speaking engagement or when I try to talk to someone to join a certain committee or council, it's about them really identifying with maybe your path or your story that they might not be able to see elsewhere in the media or anywhere else. And the aspect of our platforms being powerful, especially now where we're all on our phones or online, is important. It could be life-changing to share a resource for the community, especially right now in this moment. So it's really about being able to hit home for one person that could truly change someone's life. Hearing someone else speak to you about maybe an experience that might be similar to what you're currently trying to figure out, whether it's your identity or just your background with your family, just hearing somebody speak to it is really powerful. So I commend everyone for sharing their experience and for truly being brave, because we're at our bravest when we speak up and take that initiative.
If I could just add something really quick, we've mentioned social media and everything like that. I just want to put it out there that, while it might seem intimidating, creating an account or kind of instead of cold calling, cold following people that you don't know, reaching out to these student organizations or these other students, whether you realize it or not, most of the time people are really receptive of what you have to say, and are really thankful that you're reaching out and asking, what can I do to help you? So it's not weird. It's not, odd that you're reaching out. It's really important that you're reaching out and you're making people feel comfortable. And it's really helpful, even though, it might be uncomfortable in the beginning.
Yeah, I would go back to something that you said, Juan. I think, there's a lot of young people who are watching and who will watch this, but there's a lot of folks who are not under 25 or 30 who are watching this or who care about or work with young people. We both either alluded to or mentioned tokenism, and this idea that, this emergence of youth voice being important, kind of adding a young person in here or there. What does it look like for somebody to be a real ally to the major youth advocacy movements that have been going on and that are continuing to emerge?
I think the true allyship is indeed just being accountable and not just using a youth voice once and then being like, okay, I'll check that off my list, let me move on. I feel like it's truly being intentional, listening to the needs and what they are saying that they would like to see, and try and do that, do that change if it applies, if you have the capacity to do that change. And if not, join them in advocating for it. I feel like that's really like being intentional and trying to become part of a movement or to truly support the youth.
I agree with Juan. I would also say that it really looks like using your power to elevate the student voice. I will always be so grateful to a professor that I had who really liked what I was doing, and she used her relationship with the president of the university to get me a meeting to speak to him about my initiative. And so really just using the authority and the power that you have to amplify what students have to say and putting them in those positions of authority and getting them in the room where it happens, per se.
Definitely. And kind of just to go off of your point, Kelly, how, there's other folks here that aren't necessarily college students or they're a little bit older. Definitely don't discredit, mutual aid efforts. I think, during this pandemic, mutual aid efforts have been life-saving when we're talking about like community fridges or just any virtual space where communities can come together. Definitely finding that and, finding power within that, sometimes those that are in power just simply will not listen to you. And it's definitely a frustrating thing, but that does not mean that we have to suffer in silence. There's power in community, and, speaking up and organizing within a shared safe space can be very transformative.
Thanks, Marissa. So just wanted to go right before we wrap up, wanted to go around rapid fire for, we talked about what you would say to an ally or somebody who works with young people, but before we close, what is a quick message that you would give to a young person out there who says, I have a mental health story and I want to do something? What would a quick message for that you would have for them be? And I'll start again with Juan, and we can go in the same order.
Yeah, I definitely say just you're the expert of your own experience. It's not wrong for you to share, and you could truly help save someone's life, and it really will help you grow as well. Oftentimes people might be scared of speaking up or seeking resources, but by doing so, you're helping yourself and others. And I would also encourage them to continue their journey and by having a vision and passion, and to do it when they're ready for it. Don't feel the need to jump right into it. There's no perfect timing for it. There's no perfect way to do advocacy, but just the fact that you are considering and willing to share your story at a certain point in your life is truly transformational. We oftentimes say that the mental health system can't be a one-size-fits-all, and the only way we ensure that happens is by having different perspectives in the system.
Ananya.
Yeah, I agree with everything that Juana said, especially the part about your experiencing being so valid. And I know that it can be really, really daunting sometimes to get involved in the space, especially if you're not sure like what other people have been going through, what kinds of things there are. I would say don't forget about just starting with your local community first, starting with the people around you, whether that's your friends, your peers, your family, you know, bringing up this conversation at the dinner table, wherever you can, to sort of promote more dialogue around mental health. I know that's especially hard, especially when you're in a community that it's especially stigmatized in, like different cultural communities, school communities, but you'd be surprised how much impact you can make just by the people around you. And just sort of starting small. And then I think the other thing that I would say is know yourself. It can be really easy, especially as a mental health advocate, to lose sight of your own needs and if you need to take a break because you're so focused on supporting other people. But definitely don't be afraid to step back. Don't be afraid to take time for yourself, because you can only help others if you help yourself first. And burnout is very real and not talked about enough. So yeah.
Thanks, Ananya.
I definitely, sorry.
Go ahead.
I definitely agree with that, Ananya. You know, like I had mentioned before, I feel like I keep reiterating myself, but you know, it's okay to start small, and it's okay to, you know, recognize that maybe you're not ready. I know for me, it took me a very long time to learn how to ask for help. You know, healing and empowering yourself takes time, and just know that that's okay. It's okay to take things slow. I think, you know, in this age of social media, we see so much that seems to happen overnight, but really what folks don't see is all the work that you're doing outside of that, you know, before you present yourself on whatever platform. You know, there's a lot of work behind the scenes that we don't see, and just know that it's not going to happen overnight, and that's completely okay. If it does, great, but if not, it's okay. And you know, there's definitely other steps that you can do beforehand that are definitely important.
Go ahead, Joi.
Yeah, I really just want to touch on like what Marissa said and about asking for help. Be an advocate for yourself first. Learn how to do that, because when I was a freshman, I didn't even know what the ADA was. I didn't know what student disability services was, but once I started seeking resources for myself, I could tell other people, hey, this thing exists, especially departments or services that have very low visibility. And also, like everyone has said, don't be afraid to start small. The idea of starting a movement can be so daunting, but don't let that fear paralyze you. My first act of advocacy was giving a presentation in a gen ed class about mental health stigma. It wasn't a class about mental health. It was just give a presentation on anything. And I started with, hi, my name is Joi, I have depression. Just something as simple as that. And someone coming up to me after the class who I didn't know and said, hey, like, I really appreciate your presentation. Your story and your experience is so powerful, and you don't have to write a book or make a long, super artsy social media post to get people's attention. Just start a conversation, just speak your truth.
I couldn't agree more with what all of you guys are saying. I would say for me, knowing when to and how to ask for help, kind of going off of what everyone else has already said, but you know, knowing that people care about you, and you should ask for help if you feel like you're struggling. And then going off of that, you know, kind of as you build your own support system, that's a form of networking to begin with. And that network that you form when, you know, you speak with others and explain your story, that becomes really important when you try and build your initiative or whatever you're trying to go on to build, as an advocate. So really just, you know, communicating with people, I think for me in my experience has been the most important thing, you know, not hiding my story, not, you know, pretending that everything's okay. When you feel comfortable, really just getting out there and being vulnerable, and then just using those connections that you've made to, you know, help others, inspire others, build your own platform that you want to make. That has been really transformative for me.
Awesome.
And if
Thank
you're
you.
having these, if you're having these, you know, thoughts of what can I do? I want to do something. I would say, do it, because, you know, you're going to regret it if you don't. So definitely do it, get involved. And I'm sure all of us here be more than happy to help you with that.
Thanks, Braden. Thanks, everybody, for sharing your awesome work and experience. And I'm running us over, so I apologize. Thanks to everyone for listening. We will take a quick break, and then we will be back soon with NBA player and mental health advocate Kevin Luff. Don't go far.